body's commitment to helping Nebraska babies be born healthy and get every fair shot once they're here. This year alone, we've already passed Senator Smith's bill to screen for congenital heart defects in babies. In Health and Human Services Committee, we've discussed how to prevent pertussis, also known as whooping cough, in hospitals. And in the Banking, Commerce, and Insurance Committee, we've considered insurance changes to ensure that babies who are sick can get the formula they need to survive. Expedited partner therapy is another opportunity for this body to address two of the causes of adverse outcomes in birth. It is critical that pregnant women are treated and not reinfected with sexually transmitted diseases, because STDs pose not only a danger to the mother, but threaten the pregnancy and health of the child. LB528 deals only with two types of STDs, chlamydia and gonorrhea, and these both can have critical consequences for Nebraska babies if their mothers are infected during pregnancy. Women with gonorrhea have higher rates of miscarriage, and untreated gonorrhea makes the baby much more susceptible to HIV if exposed. Both gonorrhea and chlamydia cause preterm birth, which can lead to expensive stays in the NICU for Nebraska babies. This is a grave concern, because 1 in 9 babies in Nebraska is already born preterm. Additionally, both diseases are capable of passing from mother to child, and in 2011, 317 babies were born with chlamydia and gonorrhea in this state alone. Gonorrhea can spread through the child's system and cause blood and joint infections. Chlamydia can also cause pneumonia in the baby. And finally, worst of all, both can cause eye infections, which can lead to blindness for these newborns, our most vulnerable Nebraskans. And let me stress, all of this is preventable. Nebraska is known for many things, including our amazing football team, our unique one-house legislature, and the fact that we have the highest rate of chlamydia of anywhere in the country. One of the things that makes chlamydia and gonorrhea so pervasive, despite the treatability of these diseases, is the likelihood of reinfection. If one partner is left untreated, there is a high probability that they will reinfect the other. Because of this, medical practitioners must have tools outside the traditional treatment model. One method the CDC has recommended to address the problem of STD infection and reinfection is expedited partner therapy. This method of treatment is supported by the American Congress of Gynecologists and Obstetricians, or ACOG, and LB528 was supported by the Nebraska Medical Association, Nebraska public health officials, and the Nebraska affiliate of the American College of Nurse Midwives. There were no opponents, and LB528 was voted out of your Health and Human Services Committee unanimously. Expedited partner therapy is the practice of allowing a patient who is diagnosed with chlamydia or gonorrhea to provide an additional prescription to his or her partner in order to treat the STD. I'd like to give you a scenario where expedited partner therapy would most likely be used, and since OB/GYNs are the dominant practitioner utilizing this method of prevention, I'll use the example of a pregnant mother in her first trimester. If the practitioner diagnoses the pregnant woman with chlamydia and the woman indicates that her partner is unable or unwilling to come into the doctor for treatment, the doctor will have her call her partner in the room to get a name for the prescription and then ask about any allergies the partner may have. She will then go home with a prescription for herself and one for her partner, and the two of them will be treated for the disease concurrently. Now let's consider the reverse. If expedited partner therapy is not used in this instance, the mother goes home with only her prescription, and she will most likely do two things. First, she can take the entire prescription herself, but run the very probable risk that her partner will reinfect her before she gives birth, at which point her baby will be born with severe health risks. Second, she could split her prescription with her partner, and neither partner will receive the strength needed to kill the bacteria, and both will remain infected. LB528 is our opportunity to give this mother, her partner, and her child the best chance of living and being born disease-free. LB528 is an issue that was heard last year, and the bill has been modified to outline the CDC's recommended protocols, including a name on the prescription, the distribution of a medication guide, and compliance with pharmacy laws. Expedited partner therapy practice is expressly permitted in statutes in 32 states and is currently in use in 43 states. Here in Nebraska, our law is silent on expedited partner therapy, and this omission deters some providers from using this critically important treatment method. I want to be clear, expedited partner therapy is not for partners who are able to visit the doctor. This is for those who are unable or unwilling to visit the doctor and who are likely to reinfect their partners. These partners are unable to seek treatment because of a variety of barriers that prevent access to care. If you think this is a minor problem in Nebraska, let me share some testimony from the committee hearing. Dr. Richard Brown, CEO of Charles Drew Health Center in Omaha, testified from his years of experience that if he looks out his window and sees 10 youths standing on a street corner, at least 7 of them are infected with either chlamydia or gonorrhea. If we apply that statistic to this body, that means 34 of my colleagues are infected with chlamydia and gonorrhea. If there are 7 infected youths outside Dr. Brown's window, those youths will become parents someday, and that turns into 7 babies more likely to suffer from birth complications, potential lifelong disabilities, and attending increased costs for their health care. All of this is preventable. Expedited partner therapy alone will not solve our STD epidemic, but it will make a world of difference for the babies whose parents are treated with it. I thank you for your time and attention to LB528. There's one committee amendment that aligns this bill with pharmacy laws, and there are 3 additional amendments. The first calls for additional educational materials, which is, of course, a great idea. The second, removing gonorrhea, I think would not help the bill in any way. And the third, regarding minors, is something that I look forward to discussing on the floor, especially in regards to federal preemption possibilities and the inaccuracy of the age. So thank you for your consideration of LB528.